My name is Dr. Ed Garcia. I'm an interventional pain medicine specialist here in the Webster-Clear Lake area, kind of south of Houston. I did my training, my undergraduate training at Texas A&M University, and I did my medical school training at Baylor College of Medicine. Well, I first realized that I wanted to go into medicine. Actually, when I was young, I wanted to be a mechanical engineer. I loved tinkering with cars and all kinds of different mechanical things. But in 10th grade, I had a biology teacher. His name was Brent Barron. And Mr. Barron brought out the engineering of life. It was just amazing. It was a phenomenal class that, he made all these, the way that cells worked and functioned and the way that they grouped together to form tissue and all that. It was like a mechanical engineering marvel, but it was live cells. At that moment, I started to really get more into biology that ultimately led me to go into medicine. I chose interventional pain medicine primarily because of an experience that dated also in my childhood. My father was in Vietnam, and he ended up learning acupuncture. And then when we were young, he used to actually treat some burn children that would go to the Burn Institute here in Galveston at the Shriners Burn Institute. And my family comes from Colombia, and so we would, my parents spoke Spanish and would house the parents of these children. And at times the children would come over after treatment at the Shriners, and my father would do acupuncture on these kids to help their pain. And I remember I was quite young at the time and just marveling at how much relief they would get just through some needlework and stuff. So that always stayed in my mind. When I was in medical school, then fast forward years later, I had the opportunity to do a rotation, an elective rotation, in what was a brand new field of interventional pain medicine. They had just brought in at Baylor College of Medicine a new professor to open this clinic up, and I happened to be the very first student to sign up. There were no residents, no fellows, and he allowed me to do almost everything that you would do with a resident. So I was fascinated. I loved it. I knew at the end of that month that this is what I was going to do for the rest of my life. And here I am 30 years later, still doing it. So, I have a particular liking of treating complex cases. I'm sent various conditions or patients who have various conditions that are very complicated neurologically. I treat complex regional pain syndrome, which is a big mouthful, but it's a very disabling neurological disorder. I treat a lot of other kind of spinal conditions and conditions that can be mixed and complex. So, I still maintain an affiliation as a clinical assistant professor at the Department of Anesthesia at UTMB, even though I'm a co-founder of a private practice, Space City Pain. But through that, I have done a lot of clinical research projects and am involved in a lot of advancing complex treatment strategies for these very complex cases. So I end up seeing a lot of patients with very complicated disorders, which gives me even more satisfaction to help them through that, and in many cases help solve their painful problems. What I love about working with my patients is seeing them get better, and that's getting better whether it's through what I'm doing or through their identifying ways on their own to get better. But ultimately, when I'm dealing with people who have chronic, severe, painful, disabling disorders, seeing them show step-by-step improvements, seeing them get better at, especially functionally better, seeing them, somebody who could be a grandmother who wasn't able to take care of her grandkids or play with them, and suddenly now she can, or see somebody who wasn't able to kneel at church and now suddenly they're able to, see somebody who loves gardening and wasn't able to, now suddenly they're gardening. Seeing them get restorative sleep, all these things that make your quality of life better. So really seeing them improve their quality of life and getting that feedback. It's wonderful. So there's lots of misconceptions about pain medicine in my field. Probably the best thing that I could tell patients would be, well, there may be two things. The first is if you're referred to an interventional pain medicine specialist, trust it. Trust the process, because I think a lot of patients are fearful when they're sent to somebody and they hear pain. All they think is pain management. They think of pill mills. They think they're going to be referred to be put on dope. And that's the farthest from the truth. What we do is actually give people alternatives to these various powerful narcotic medications. So that's what our field is about finding alternatives, finding better ways. So trust in the referral. And secondly, I would say, make sure you're going to somebody who's qualified. A lot of times when people are referred to a pain medicine specialist, they may not be qualified. They may not be fellowship trained. They may not be board certified in that specialty field. So as long as you're going to somebody who's properly trained and qualified, then trust where you're going. Why do I choose to work here at Houston Physicians Hospital? I think that's a very easy question to answer. Of all the places that I've worked at, and I've worked in a multitude of institutes, including academic centers and big community hospitals, small community hospitals, it boils down to the people. I got to say that the people at Houston Physicians Hospital, the employees care. They care significantly. From the very beginning to the beginning experience that my patients have to the very end, every person they come in contact cares tremendously about their experience. I hear nothing but praises. The hospital in itself is a beautiful hospital, but there's plenty of beautiful locations that aren't so beautiful once you meet the people inside. This is just the opposite. The people make the location. I think the experience that my patients have is second to none, and it is because the people truly care about giving them the best experience.